You are watching the Randy and Christa Show. I'm Randy Alvarez.
And I'm Christa Orecchio. This is news that makes you healthier. And today we're talking about vitamin D deficiency and its connection with depression with a good friend of mine, integrative psychiatrist, Dr. Sara Van Anrooy.
Dr. Van Anrooy, welcome to the program.
Thank you, Randy and Christa. Excited to be here.
So for people that don't know your practice in Colorado, because I guess you're not a traditional psychiatrist, who's your typical patient and what are the different services you offer?
Sure. I run the Center for Stress Medicine. And so basically, I work with a lot of stressed out people. We got a few out there. So the typical client who will come to our practice will be feeling exhausted, can't sleep, might be dealing with a lot of anxiety, maybe feeling depressed, and just not thriving.
So, Sara, I'm so excited that you're here. I know we've gone back and forth through email for years, actually,
yes.
about vitamin D deficiency and depression. And you said that 70 to 80% of your patients, and I would agree with my clients, are deficient in vitamin D. So how does filling your vitamin D deficiency avoid you from using antidepressants or mood stabilizers?
That's a pretty exciting thing that I found in my practice. About 8 years ago, when I first became aware of the problem, and the problem really has been described as a pandemic, so it's a pretty severe problem, all across the world, of vitamin D deficiency. And that's when I first started screening my patients and was really pretty shocked to find how many were deficient. We live in sunny Colorado. People are outside all the time. Even some of my clients with fairly good tans could come in with a full-blown deficiency.
So, and before we went on air, I asked you, do you have patients that were depressed that had low vitamin D levels, that you gave vitamin D, combination with fish oils and lifestyle, et cetera, that without medication, their depression went away? And I think you said yes.
Many, many. In fact, those are my favorite clients to work with. Where a lot of times they'll come in and basically, the most common symptoms I see of vitamin D deficiency is people describe they just don't have the mental or physical energy to deal with anything. So life feels overwhelming. They've lost motivation. They don't have good mental clarity. And so they think, or their doctor thinks they're depressed. And so they'll refer their patient here. And then what I find oftentimes is especially if they have a full deficiency, so below the lab normal, almost more often than not, depending on the severity of the depression, but for mild to moderate depression, if I treat that vitamin D deficiency, then oftentimes along with a little bit of coaching on stress management, helping them to get deeper, more restorative sleep, getting their life a little more in balance, I'm able to avoid prescribing antidepressants and mood stabilizers.
The people will say things like, I feel like I have my life back.
Yes.
I can't believe it was this simple.
Yes.
How come nobody ever told me that vitamin D, there was a connection?
Yes, very much, especially early on when I first started detecting and treating vitamin D deficiency. I was met with a lot of skepticism. Many of my patients would really kind of question my judgment as far as really a vitamin is going to really make a difference or change my life. Just give me the antidepressant. And typically what I find are those patients who are going to have a really good response to the treatment of the vitamin D deficiency. I see it pretty quickly. So oftentimes I'll talk them into, well, let me treat your vitamin D deficiency, help you to get deep restorative sleep. And if you're not feeling substantially better in 2 to 3 weeks, then let's sit down and talk about medications.
Okay. Go ahead.
What kind of vitamin D quality and dosage constitutes treating typically? That's a good question. What do you use?
Yeah, that's a really good question, Christa. And that's one of my pet peeves as far as some of the research that's out there about vitamin D and the effectiveness of using vitamin D to treat depression is so oftentimes what people are focusing on is what's the proper dose. And the reason that that's the wrong question to ask is what we really need to look at is what's the ideal blood level of vitamin D. vitamin D levels, typically I shoot for 60 to 100, what's called nanograms per milliliter. And one patient, I might be able to get there with 2 to 3,000 units of vitamin D a day. But another patient might need 50,000 prescription strength twice a week, plus the 5,000 a day.
So are
to
you
achieve the same
are
goal.
you testing them? Or I know you said that even our viewers watching, you can order your own vitamin D finger prick test. So should you supplement and then test every day or every couple days?
What's the test you recommend?
First of all, you always, when you're doing testing of levels, you always want to make sure the lab you're working with, is a certified licensed lab. Because otherwise you may not be getting accurate results. Typically what we do here is every patient that comes in, if they don't already have a recent vitamin D level from their physician, then we get vitamin D. We check other things too, like iron stores, B12 levels, many thyroid levels, things like that. But if they are fully deficient, then what we do is I start the vitamin D treatment, and then 2 or 3 months later, I'll recheck their level. My goal, again, is to see them in that 60 to 100 range. And once they're in that range, then I'm able to, like if they're on prescription vitamin D, I'm able to decrease the frequency. Then I recheck it every 2 to 3 months.
Do you look at these lab values differently than most? That means that somebody may say, I had my vitamin D levels checked, they were fine. Are you more aggressive?
I get that all the time. Less and less, the more people are getting educated, about vitamin D, including physicians, because the challenge with things like vitamin D, ultimately it's free. Vitamin D comes from the sun. And so there's no drug company out there that's going to be going around educating physicians about vitamin D. And so it's really exciting with shows like yours that are getting some of the education out there, because there's so much misunderstanding about what's a healthy level of vitamin D, and trying to educate people that we don't just want it not to be below lab norm, but we want to have those levels up in the optimal range.
I totally love your integrative approach, and I think it's a great question that you asked, Randy, because whenever I run labs on vitamin D, the value is from 30 to 100. And so a functional range, from what I'm hearing you say, is 60 to 100. As most people will have vitamin D deficiency undiagnosed for years because with regular Western lab values, they're saying they're within range. Would you say that's accurate?
Exactly. Yeah. And another important thing, Christa, is also looking at time of year. What's considered adequate vitamin D level will vary based on the season.
Mm-hmm. So in the colder seasons, less vitamin D is required?
No, well, flip side. And a lot depends on where you live. So here in Colorado, if someone's not traveling a lot to, say, the Caribbean, which is fabulous, I can't get insurance companies to pay for patients to go down there, though, to treat their vitamin D.
One day.
But basically here in Colorado in August, we naturally have our highest level of vitamin D, because that's when we're getting the most UVB rays from the sun, which is what forms vitamin D in the skin. And then we just got past our lowest point. So the end of February here in Colorado is when levels naturally are at their low. So for example, if I had a patient this time of year with a level, say, of 50, I'm not going to be as concerned as I would be if it was in August.
Let me ask you this. Is the whole idea that humans, let's say a couple hundred years ago, a couple thousand years ago, had more sun? We were exposed to more sun. And
absolutely.
Now today we have less sun. And since we need sun, like plants need sun, that now it's affecting our mood.
Yes. Very much so, and a lot of that is cultural.
So do you also believe in getting a little bit of sun too? 10, 15 minutes a day?
Yes. In fact, the research also supports, frequent exposures to the sun are much better than just staying inside all year long and then going out for a big vacation, down in the Caribbean.
Now, what about those people that, I've interviewed on the show, and they say, Randy, the problem with vitamin D is toxicity.
Yes.
Right? Because there was some talk of that in the news.
Yes, exactly. So, and unfortunately for most of us in medical school, it was harped into us about the dangers of vitamin D toxicity, when in reality there was very little research at the time. Currently, there's a lot more research, and we need more. But there's a very big difference between levels of vitamin D toxicity and being above normal. Levels, as far as when we actually see vitamin D toxicity, is typically, some people say levels need to be 200 or higher. Some of the experts on vitamin D will even say as high as 400. Going over that is what's needed for symptoms of vitamin D toxicity, whereas the upper end of normal is 100. So we have a fairly comfortable range between what's above normal and what's toxic. Okay.
As a psychiatrist, you deal a lot with people that go to you because they're depressed and they want a medication for depression.
Yes.
This is, now, by the way, with kids, and because I wanted to ask you this question, it popped in my head. Parents, I have a 12-year-old, parents are putting sunblock all over their kids.
Mm-hmm. I know.
I don't put sunblock on my 12-year-old unless he's going to be out for 8 hours at a, some trip.
Good. Yes.
So what do you say to parents about putting all of these chemicals or sunblock all over their kids?
Well, the value of sunscreen is to prevent burning. Sunburns are not good for anything, not good for forming vitamin D, not good for future risk of skin cancer. But I really encourage parents to allow their kids to get some sun, at least 10, 15 minutes out in the sun before putting the sunscreen on so that they can get that good vitamin D. The other thing with you having a 12-year-old, where I see vitamin D levels really dropping, is when kids go from having recess in elementary school years, and then they go into the middle school years, and they lose the recess.
Okay.
And when kids are on recess,
well, tell me this then. Do you see kids then that you've supplemented with vitamin D, that their grades get better, their concentration improves, they're happier?
Their energy is better. Yes.
Really?
Their immune systems are more balanced. Yeah, a number. There's some studies, and I've seen examples of where asthma improves. It's pretty neat. One of my most passionate things is when I can provide an intervention that doesn't just relieve them of depression, but makes them healthier.
How about depression today?
Yes.
And for people just tuning in with a well-known psychiatrist, Dr. Sara Van Anrooy. So fish oil.
Yes.
Give us the connection, vitamin D and fish oils.
Yeah.
They always go together?
They do in my practice. So, yeah, part of what I really enjoy doing is really looking for very evidence-based, effective, natural interventions, basically to promote brain health. And clearly, both the research as well as my experience shows that fish oil and vitamin D are two foundations for brain health. And they work together very well. In fact, if people take fish oil when they take their vitamin D is fat soluble. So if we take it with a little bit of fat, such as fish oil, we'll absorb it better as well.
Okay, people are going to watch this and self-medicate. They're going to go home and they're going to go to the store and they're going to buy. They're going to say, I think she said, whatever milligrams.
Right.
Is that okay to do?
Well, to some degree. So, without the guidance of a nutritionist or physician, fish oil. Basically, fish oil it gets pretty complicated. When I was first learning about fish oil, I got pretty confused on how to compare products. And Randy, that's because fish oil concentration varies tremendously. So, one capsule of fish oil that's 1,000 milligrams may have only 300 milligrams of omega-3 in it, whereas another capsule could have 900 milligrams. So very, very different concentration. So part of what I really encourage people to do is, number one, ignore milligrams of fish oil, but instead look on the supplement facts, and there's a simple formula. If you add the milligrams of the EPA and the DHA, which are the two critical omega-3s, and then divide that by the serving size, that will give you the milligrams of essential fatty acid or omega-3
so
per capsule.
You believe in a professional brand like Metagenics, you mentioned off camera. So if they were to compare that to Costco, there's going to be much more EPA in that. So I like Designs for Health. What do you use in your practice?
I use fermented cod liver oil.
Combination of the two, because it depends on Fish oil will vary too by how the ratio of EPA to DHA. The majority of the brands out there, it's about 50-50. So to get 2,000 milligrams of EPA a day, usually you need 4,000 milligrams of combination. Make sense?
Makes sense.
Over to the results again. Okay, so are you ever surprised with the results that you get by just implementing maybe some dietary changes, high-dose fish oil and vitamin D, and getting their levels up?
I was pretty shocked when I first started seeing the benefit. Fish oil I've been recommending for probably a good 15 years, and was at that point pretty amazed at the number of my clients, for not just for depression, but for ADD, for bipolar, how much improvement I saw if I got them on a high enough concentration. Then when I started adding, treatment of the vitamin D deficiency, I was shocked and really, really excited.
When you say shocked, give me an example of either an adult, child, that you say you were shocked.
Yeah. Yeah, just by the potency, because I think.
But give me an example of the symptoms. Somebody came in very depressed, withdrawn, brain fog, whatever, and all of a sudden, that's
skin issues, maybe.
Yes. Well, I could give you an example of a patient, a 42-year-old mom, running herself ragged in 6 different directions. Very busy stay-at-home mom comes in complaining of a lot of fatigue, just has no energy, no motivation, having a lot of trouble remembering things, is having trouble sleeping, tired during the day but can't sleep at nighttime, comes in convinced that she has depression. And we do a lot of screening tests, not just laboratory work, but also some testing, that will give me feedback as far as just how severe was her depression. And her depression was in that mild to moderate range, where it's fairly safe to first check for the vitamin D deficiency and convince her to do a trial of adequate dosing of good quality fish oil, which we did with her. Her level of vitamin D came back, and this was in the summertime in August. And here in Colorado, even though she was out quite a bit with her kids, her level was only 14 of vitamin D, so pretty severely deficient. She didn't like fish, so she didn't get many omega-3s in her diet. And so by putting her on that combination of the high concentration fish oil, and then for this patient, because her level was that low in the summertime, I used a combination of prescription vitamin D called D2, 50,000 units twice a week, and then 5,000 units of the over-the-counter D3 on a daily basis. Saw her back a couple weeks later, and she was amazed at how much better. Not 100%, but she was pretty startled. And the common feedback I get, which I got from her, was that she couldn't believe she could feel this much better just with taking some vitamins. So
it
takes about a year, I'd see, to get the full balance, but even within 2 to 4 weeks, it's pretty remarkable if they're going to respond, that I see the improvement.
I think that's pretty life-changing stuff. And when you say that it takes almost a year for vitamin D levels to build, I know that we're running out of time, so I have 2 final questions. And one is, I run a ton of vitamin D lab work, and what do you do when patients, you're treating them for vitamin D deficiency with fish oil and high-quality vitamin D, but their levels are still not rising? You told me something like you take magnesium away from it? Or
Yes, there's a number of things, Christa, that I look at. The number one, cause of that tends to be non-compliance. So a lot of times, I'll ask them, "Are you still taking your, the vitamin D levels I was recommending?" And they'll often say, "Oh no, I was feeling a lot better, so I stopped taking my vitamin D." Or they went to their primary care doctor, their level looked okay, so they said they don't need to take vitamin D any longer, but their stores weren't replenished, so it dropped quickly. So the first thing I look for is whether or not they're being compliant. The other thing I try to assure is that they're taking the vitamin D with either a fatty meal or with fish oil, to make sure they're getting the good absorption. Also want to make sure they have a good quality brand so that they're actually getting as much vitamin D as the label says.
So are you always, so you don't run into that? Are you always able to get their vitamin D levels up one way or another?
Well, sometimes it's more challenging than others.
But ultimately, you're able to get them up?
Yes, definitely within the normal range. Whether or not I can get everybody and keep them up in that 60 to 100 range, I like that range because there's buffer. And so if they stop taking their vitamin D for a while, they're not going to fall, below that critical level. But it's interesting. There's some research now coming out that suggests that there's at least 3 genetic markers for people who have difficulty getting their vitamin D levels up for genetic reasons. And this is something that really fits in my practice because vitamin D deficiency very often seems to run in families.
Okay, and we're almost out of time.
Okay.
Final words.
Yeah, you love vitamin
stuff.
D. What haven't we talked about that you want everyone to know about vitamin D? Is there something we haven't mentioned? Something maybe we were not ready for? But do you think vitamin D across the board is responsible for overall health?
Yeah. Well, the other thing that I think is important is don't be afraid of the sun. It's really sad to me about how the sun has gotten such a bad rap. To see people who are afraid to go outside and play in the sunshine because of this fear of skin cancer. In part, what's important to realize, the most dangerous form of skin cancer called melanoma is not just linked to genetic reasons, but also the combination of frequent sunburning and low vitamin D levels. And so again, we want to be careful with sunburning, but I really encourage my clients to get out in the sun and play. Not only do you get your vitamin D, you get the bright light stimulation, which is really good for mood. And then if you're moving, breathing, laughing, I always say if you're exercising and laughing, you get triple points. Another exercise is another incredibly effective treatment for depression.
Okay,
Nice.
so go to your doctor if you want to get your vitamin D levels checked, and do that every couple of months at least, right, if you have low vitamin D.
Uh-huh.
Okay, so our viewers
Yes, and preventatively at least once a year.
Okay, that's good advice. This is great stuff. I'm so happy that you're able to join us today from Colorado.
Yeah, delighted to share it.
So our viewers can find you at the centerforstressmedicine.com. Is that right?
Centerforstressmed.com.
Centerforstressmed.com.
Well, thanks for coming on the program. Very interesting.
Great
Thank
to
you,
have
Randy
you.
and Christa.
You have been watching the Randy and Christa Show. I'm Randy Alvarez. Christa, final thoughts? We're going to take a quick break and do a recap.
Final thoughts. Get your vitamin D levels checked. I agree with everything that Sara said.
Good.
Yeah,
Okay.
food is medicine.
Well, we will be right back.